An innovative heart procedure is changing the lives of patients with aortic valve disease. It's called the transcatheter aortic valve replacement, or TAVR. Joining us to talk about this is Dr. Clauden Louis. He's a cardiothoracic surgeon with BayCare at Winter Haven's Hospital Bostick Heart Center, and we are so glad that he is with us today. Welcome, doctor. That was a mouthful right there, but I know it's something you were so passionate about. Glad you're here.
Thank you for having me.
So let's dive right in. What is TAVR?
So TAVR is, as you said, a transcatheter aortic valve replacement procedure. You're essentially taking a valve and you're compressing it to the size of your finger, putting it within a catheter and introducing it in the leg of a patient's blood vessel and bringing it to the heart. This is to replace a diseased valve that's called aortic valve stenosis, for instance, but we're doing it by avoiding a sternotomy. No incision on the chest at all.
Okay, now I see why if with this procedure, with this device, you're able to cut down on so many of the effects post-surgery that patients have had to go through in the past, right?
Absolutely. And on the inside of the patient, you open the valve just as you would an umbrella, and then you take out all your delivery system, and the valve will stay in place.
And of course, talking about being able to stay in the hospital, you know, that's just one thing I thought of. I'm assuming there are a lot of other positives that are coming from this procedure and this device that we haven't even touched on yet.
Absolutely. So it's reducing hospital stay. For instance, if you have an open heart surgical procedure via surgery, 3 days, 4 days, 5 days you're in the hospital, chest tubes draining and everything. But with this procedure, most of our patients are going home the next morning, and some institutions are sending them home that evening.
Wow.
Yeah.
You know, I love being able to do the show and talk with you in our Best of BayCare segment so that we can learn about what's new out there for patients.
Absolutely.
I'm curious, who does this affect? Who should maybe take note watching today?
So this procedure has done so well. It was first introduced for our extremely high-risk patients and those patients who otherwise could not tolerate a surgical procedure. Because they started to do so well, it was then done in clinical trial to high risk, to intermediate or medium risk, and then low risk. So now it's patient preference. But still, those who can't have an open heart surgical procedure, they are some of the best candidates because no other opportunity exists. But even low risk patients are doing well.
I'm so glad to hear this. Again, it's so exciting to learn what you have been working on and how you continue to provide that care for patients. Well, we want to make sure and share the contact information. Of course, if you want to learn more about this procedure and this device that we just talked with, or even wellness tips, just go to baycare.org.